Dr. Ray. Dr. Ray is an orthopedic surgeon, and he works for the Federal Medical Center, Abuja. So, Dr. Ray, we're happy to have you on this call. So, Dr. Ray, if you're ready, please go ahead.
Now, once again, my name is Dr. Ray, as already been introduced, and I'm going to be discussing on the tri-active technology as a complementary therapy. Like I said, it's actually a paradigm shift in the sense that this has been happening in other climes where the nutritional nutraceuticals have been employed in medical care to complement what they're doing, and a better significant outcome are achieved in the treatment of our patients. The role of Purxcel as the tri-active technology to achieve this cannot be overemphasized. Like already shared, we see the prescriber's digital reference, that's pdr.net. You can appreciate the fact that the information is fully there. Now, let's look at some of the health conditions based on research that have been going on, based on what others have been doing, understanding the fact that it has been in the research over the decades about the use of the antioxidants to complement what we're doing in some of these health challenges we encounter in our management. Let's pick some of the main chronic conditions. For instance, hypertension. Robert Zuska made a research in June 2016, and they show that disturbances in glutathione metabolism might explain some age-related increases in blood pressure. So we already understood the negative balance in the reduced glutathione and how its depletion can be responsible for over 74 degenerative diseases. Now, this study has confirmed that and suggesting a possibility of complementing this, or at least supplementing it to be able to correct that. Now, let's also look at SOD, that's Superoxide Dismutase, in the management of hypertension, or complementing what we're doing in hypertension. Guillaume Bellsgadgets et al. In his study in published in American Journal of Hypertension, that was 2002, yes, but he was able to find out that the membrane permeable SOD mimetic is actually a model study, that this attenuates the progression of blood pressure elevation in a model of severe hypertension. These effects were associated with reduced vascular hypertrophy, decreased degeneration of oxygen radical, and increased plasma antioxidant concentrations. Our findings suggested that oxidative stress plays an important role in the pathogenesis of hypertension in Sutherland's model, and that process may be due in part to reduced sensitive vascular remodeling. And that was then. Now, looking at diabetes mellitus also, and glutathione, Consuelo Borras et al. In 2018 did a study on glutathione metabolism in type 2 diabetes and its relationship with microvascular complication. This is a human study. It's actually a peer-reviewed case control study that was done in 2018. Reduced synthesis of glutathione contributed to deficiency in patients with type 2 diabetes, and it is more marked in those with diabetic complications. There may also be increased reversible utilization of glutathione by non-glycemic mechanisms. So either overutilization of the existing glutathione that endogenously synthesized, or there is a reduction in the production, overutilization or reduction in the production. The exact mechanism wasn't very clear, but suggested was on the possibility of supplementing this, that this might help to revert or enhance the care of these patients in the recovery. We also have glutathione in diabetes mellitus, and Kai et al. In his study discovered that glutathione deficiency in type 2 diabetes impairs cytokine responses and control of intracellular bacterial infection. That was a study that was published in 2012, Journal of Clinical Investigation. So the finding was that poor interleukin-12 production correlated with the deficiency in the intracellular reduced glutathione concentration in diabetic patients. And addition of glutathione as well as NAC to selectively restore interleukin-12 and interferon and gamma production and improve bacterial killing. Further depletion of the glutathione in the mice led to increased susceptibility to melioidosis. Melioidosis is one of the intracellular bacterial infections, and so that means that patients with diabetes can be exposed to more intracellular bacterial infection that are recalcitrant to treat because of low glutathione, and so supplementation becomes important. So this can complement the care of your diabetic patients. Now, that's about glutathione. SOD diabetic mellitus, Ojoye Ngoye et al. In a study in Nigeria, Rivers State in 2016, discovered that type 2 diabetes is associated with decreased antioxidative status. As the level of oxidant enzymes, SOD and glutathione peroxidase were significantly reduced in the diabetic patient. The increasing duration of the illness further depressed the antioxidative system. As the disease condition progress, antioxidative parameters are further depleted, showing an increase in oxidative stress. It is thus recommended, that was part of the study recommendation, that oxidative therapy be incorporated in the management and therapy of type 2 diabetic patients to supplement the endogenously synthesized antioxidants such as the glutathione, such as SOD. And so what we're talking about here is that in the tri-anti technology, the Purxcel, where we have especially these two master antioxidants and all the complementary ingredients can perform that particular function that these researchers were actually recommending for. And so we have a product that is a breakthrough that can help to achieve the diabetes with the use of Aloe Acemannan. Samane et al. In April 2015, in his study that was published in PubMed, it's called the use of aloe vera extract in pre-diabetic patients could revert impaired blood glucose within 4 weeks. But after 8 weeks of the use of this could actually alleviate their abnormal lipid profile. We know that many diabetic patients also have abnormal lipid profiles. So if you can maintain this for a short length of time, this study showed that aloe high molecular fraction, that is Acemannan, prepared by patented hyperdry system, exhibited a significant hypoglycemic effect. It can lower not only the glucose, but also the triglyceride levels, which are often in diabetic patients. So, and this study were carried out with no hepatonephrotoxicity detected in some researches. And so that is then anti-technology in fertility, and this glutathione and fertility, according to Oyeweko et al., another study that was carried out in Nigeria and published in PubMed, showed that glutathione is the body's major antioxidant, which helps in preserving all other antioxidants. It is a natural antioxidant present in both the male and female gametes, and its level vary widely. It has been confirmed that it plays an important role in maintaining the biological value of germ cells, and it has been implicated in the fertilization process and early embryo development. Another study now focusing on SOD and fertility, similarly, was carried by Surasendi et al. In 2017. That study showed that administration of SOD in the intrauterine insemination program provided higher pregnancy rates than placebo, even though the results were not so significant. Antioxidant administration also improved response of ovarian stimulation and significantly increased endometrial thickness, and then subsequently the pregnancy rate. The use of antioxidants, mainly SOD, seems beneficial in certain cases, including older women and cases of primary and recent infertility. Now, a broader research is needed, though, and conclusions not yet there, but all these factors are pointing out what Purxcel has come out to really help us in the medical field to assist our patients in different conditions we're managing. If you go in the lot of researches, many diseases and many disease conditions, there are a lot of researches on that, but I'll just pick a few of them to showcase to us that this complementary therapy is actually needed now. Olufemi et al. In their study in May 2019, that was another Nigerian study published in the Pediatric Hematology Oncology, revealed that the findings in the study suggested that deficiency of some antioxidants, measuring them, including manganese, vitamins A, C, and E, SOD, and glutathione peroxide, is one of the non-genetic factors that are associated with vaso-occlusive crisis in children with sickle cell anemia. It is possible that those with more severe disease have an increased requirement as a result of oxidative stress, or they have higher losses of micronutrients, which may contribute to the disease severity. And so complementing the care of these patients with triactive technology might go a long way to help these patients. Tosumi Egumbi et al. Is another Nigerian study published in PubMed in 2019, September, less than a year ago. The role of SOD in maintaining vascular homeostasis also contributed to the vital part it plays in modulating sickle cell disease pathology. So further exploration of the events that led to SOD2 activity regulation of sickle cell will provide a clearer understanding of SOD role in the progression of sickle cell disease pathology and potentially produce improvement in clinical outcomes. In particular, importance of SOD in the vascular world has not been thoroughly investigated. That is the affirmation. But we anticipate that SOD supplementation would confer protection to the endothelium during acute and chronic oxidative stress events, potentially reducing the incidence of pulmonary hypertension. That was their study. A lot of studies we still need to, support all this, but it's getting clearer in the horizon as we see all these studies coming up. Now let's look at some of the neurodegenerative conditions like glaucoma. Ferreira et al. In his study in 2011, the relationship between oxidative stress and neurodegeneration is not completely clear. That's true, but mentioned that free radicals can act directly as neurotoxic or may also function as secondary messengers to spread the damage. Our results would suggest that further research regarding the use of antioxidants as an adjunct therapy in glaucoma may be indicated. Treatment interventions to reduce in vivo oxidative stress may be important in patients with this disease. And so, trying to emphasize that those studies still need to be carried out in as much as focusing on the multifactorial causes of glaucoma and treating increased intraocular pressures. We also have to look in the direction of complementing what we're doing using a triactive technology. Cataract has also some researches on that. According to Lin et al. In 2005, overexpression of SOD1 in whole lens prevents hydrogen peroxide-induced oxidative damage, that's cataract formation, to the lens and subsequently control of gap junctions by protein kinase C gamma. Now, that means SOD supplementation might help in the care or reduction in the incidence of cataracts in the prone patients. Mandel et al. Also did a research on cognitive improvement with glutathione supplementation in Alzheimer's disease. We know that Alzheimer's disease is one of those very difficult conditions to manage. But this research in 2019 to compare bioavailability, the effect of oxidative stress markers, and the safety of a new sublingual, they were assessing a new sublingual glutathione assessment. But in the end of their studies, they reached out that a nutraceutical formulation containing that's NAC, among other compounds like our Purxcel, has shown some pro-cognitive benefits in Alzheimer's disease and older adults. Though this result was confirmed to be better once we have that, especially in the oral formulation, than the injectable NAC. Now, with conclusion, lots of studies have incriminated oxidative stress in the etiopathogenesis of many disease conditions. This invariably connect antioxidants as role players. Studies have also confirmed some of these roles at individual levels, just as we just discussed picking up the role of these different components or master antioxidants at different disease conditions. But the triactive technology suggests comprehensive employment of these master antioxidants as nutritional supplements to obviate the consequences of the exhaustion in certain higher oxidative stress conditions. This even applies even in younger children. And so that's why we are trying to encourage the complementary role of Purxcel in our healthcare services. Thank you so much.